Hello, my name is Professor Dr. Erich Minar. I'm now working in the Wiener Privatklinik. I have here my office and are treating the patient on an in- and outpatient basis. I did my study of medicine in Vienna, finished in 1978, and then started my education and training in the General Hospital in Vienna, and finished my study in 1978. I had a special promotion. It's called Sub Auspiciis Praesidentis, which is given for students who did every examination with an excellent result. Then I started training in internal medicine in the General Hospital Vienna and finished with habilitation in 1988. After this time, I also opened my private office here in the Wiener Privatklinik. I had specialization especially in vascular medicine, in cardiovascular medicine, but I was trained in all parts of internal medicine, also especially in diabetes, nephrology, gastroenterology. I had regular office up to now here in the Wiener Privatklinik, but worked further in the General Hospital in Vienna and was also for 8 years then head of the Department of Angiology. I retired from the General Hospital in 2018, and since that time I'm fully working here in the Wiener Privatklinik with mainly treating patients with vascular disorders, but also treating patients with all different diseases concerning internal medicine. My special interest is in treating patients with peripheral arterial diseases. The main symptom of these patients is pain during walking. It's called claudication, and these patients are worked up, especially with duplex sonography, where one can localize where the main problem is, stenosis or occlusion of the arteries, and very often these patients can then be treated by balloon angioplasty or by stent implantation. That's the same as in coronary diseases, when patients are also treated by stents. I'm working in all vascular fields without coronary arteries. That's mainly peripheral arteries, in the lower leg arteries, renal arteries, but also in the carotid arteries, where patients with stenosis can be treated by stent implantation. Here, of course, we are we are working together with vascular surgeons. Another main field of my work are patients with venous diseases, especially patients with venous thrombosis or pulmonary embolism. The primary workup in these patients is also by duplex sonography. Many patients are coming with pain in the legs and have fear of venous thrombosis, and it's very easy to diagnose or exclude such a thrombosis by duplex sonography. And most of these patients nowadays can be treated on an outpatient basis. Many of my patients also come primarily with pain in the legs, and then it's my job to do differential diagnosis if this pain is caused mainly by any vascular disease or any other diseases, especially lumboischialgia or other problems concerning the hip or knee joints. I look forward to treat you if you have any problems, especially with vascular diseases, here also as an in or outpatient in the Wiener Privatklinik.